Welcome to our podcast, PA Mindset Matters. I'm Jessica Spissinger, and we're excited to introduce you to our mini mindset editions.
I am Mercedes Dodge, and we created these short episodes for PAs, PA students, and all healthcare providers who want a moment to pause, reset, and reconnect with purpose.
Each episode, we will explore a reflection, practical insight, or mindset shift you can apply right away in training, in practice, and in life.
Because how we think shapes how we show up for our patients, our colleagues, and ourselves. So let's get started.
All right, I'm so excited to be back for another mini mindset. These are some of my favorite topics that we've been going over. Last time we spoke about trauma. And today we're going to talk about seasonal affective disorder and the winter component. And you are down in Texas.
Yeah.
Do people have seasonal affective disorder in Texas?
Yeah, we do. I think as the days get longer and it is getting colder in Texas, believe it or not, we had snow just a week ago. It really impacts people's mood and their patience.
Absolutely. So we're going to talk about kind of understanding the nuances with seasonal affective disorder. Not doing history this time, but jumping into a little DSM nuance. So what is seasonal affective disorder? Whenever we say it, we tend to think of winter depression. I always like to say that seasonal affective disorder is not always a depression, nor is it always in the winter. It's a subtype of other mood disorders, specifically major depressive disorder and bipolar 1 and 2 disorders that can have a seasonal onset. All right, so we're going to focus primarily on the winter subtype. So this is generally when we're seeing the mood changes with the fall or winter onset. With any kind of seasonal disorder, it has to start around the same time and also have spontaneous remission around the same time. It is thought that with winter subtypes, it's this lack of daylight, which is thought to be more of the important factor. So in the winter, it can vary based on what climate you are, but some of the triggers are shorter hours. Here right now in Massachusetts, the setting at like 4:30 in the afternoon. We've had a lot of really bad weather. We've still got about 2 feet of snow on the ground. Storms can really cause a lot of upset for people. Sometimes you're just trying to go about your daily life. It feels like a struggle enough. And the next thing you know, you have to scrape off all the ice from your windshield with a credit card because you can't find your ice scraper, or you're literally wrestling your garbage bin over low temperatures can really provoke people and cause a lot of agitation, especially if you're living in a house where there's heating problems and you are struggling to get your home to a moderate. When it gets cold inside, you don't want to move. You don't want to cook for yourself. You just go into this huddle mode. So it really can kind of cause this exacerbation of stress for people.
Mhm.
With what you would expect with seasonal affective disorder for winter onset depression, you're going to see all your classic depression features, which we know can come in a variety of ways. However, you do tend to see more like specific clinical differentiation, more of those atypical depressive symptoms. That's more of that like psychomotor retardation without paralysis, and the hypersomnia, increased appetite with specific carbohydrate cravings, subsequent weight gain, which can also worsen people's like sense of self and self-esteem.
Mhm.
The reason why I say 5% there is because it's actually thought that across the population, about 5% experience some sort of like winter onset seasonal affective disorder. There is a summer variation at 0.5%, so much smaller. Risk factors for developing seasonal affective disorder, obviously the family history, it's kind of all the same for like a major depression, female sex being more at risk. What's also interesting is that there's more of a risk factor in the northern latitudes. And this is based
Really?
on a lot of global studies. Yeah, you would think that, it would be analogous on like the southern latitudes, but not so much. So we're going to kind of just dive right into the treatment options because we are generally familiar with depression. I went over what's a little bit
Mhm.
different for the winter components. And the treatment is pretty interesting. In some ways, you approach seasonal affective disorder like any other depression, but with the element of light therapy and different lifestyle interventions. So we're going to go through these different modalities. I liked this graph. It's from the American Academy of Family Practice. They rate the different evidence on how robust it is. It is very clear that light therapy stands out as really a pivotal approach. So why does light therapy work? Circadian rhythm reset, serotonin effects, and melatonin regulation.
If we think of longer nights, longer days, less light, and the reason why light is so important, it's kind of our natural cue for our body to increase its melatonin, right? And so it has a particular rhythm in our circadian rhythm. Everyone has to help the circadian rhythm. And that means getting enough light, getting enough exercise. So if we are having seasonal affective disorder, what is the best to help our sleep and our depression? It's light.
Sometimes like right now, it's like the sun is setting at like 4:30. There's some people who just don't even start their day until 11 a.m. or 12 p.m. They get out, they've got like 3 hours of light and then it's gone. Sometimes that's a personal choice, but sometimes that's not an option. It's the way somebody's schedule works. And in the summer,
Mhm.
it's just fine. But then in the winter, they're really getting a reduction of light exposure. There's a lot of benefits in terms of its impact on your circadian rhythms. There is also connection with serotonin, which I think is helpful to educate
Mm.
our patients on that it can provide some serotonin boost, and also the importance of like melatonin regulation. When you're advising patients to have light therapy or talking to a friend, the recommendation is usually around 10,000 lux. Some of the research has been done from exposure of 2,500 to 10,000, but 10,000 is the key number to remember. From 30 to 60 minutes is ideal, especially early morning. The way it can work, people could have it by their bedside, they could have it on their office desk, they could have it in the kitchen when they're washing dishes. It's a pretty nice rapid response, about 1 to 2 weeks. Is this something you recommend to your patients?
Yeah, I mean, the what you're talking about, the light therapy, is what I think about for depression and bipolar even. Get out, get some light, get moving, and that will help. There's a lot of evidence in getting light, and it's not just going to be taking a vitamin D supplement to get that vitamin D. We need the actual light exposure. This research is very indicative of the psychoeducation we give to other mood conditions. We need to get out there and get light, and if it's not there, we need to create the atmosphere.
But since we don't have that, we have Amazon and Google and like Walmart. And so you really can get pretty affordable, like happy lamps. And there's so many varieties and there's all sorts of like gadgety, like bells and whistles you can have, but you can keep it really basic. So I very strongly urge my patients to like look into getting themselves the lamp that they can use in multiple
Mhm.
locations if they can make that work. There's lots of options out there. As far as psychopharm, bupropion is the only FDA approved
Mhm.
medication for seasonal affective depression, and that really is intended for the winter onset depression. As somebody with a summer variant of seasonal affective depression, it's probably not going to do as well on bupropion because they tend to be more irritable with insomnia and agitation. SSRIs, fluoxetine, and sertraline have also demonstrated good improvement with symptom remission, comparable to the light therapy. Sertraline, in particular, in the study I looked at, was more robust versus placebo. And there is actually a very specific cognitive behavioral therapy approach for seasonal affective disorder. It's a 12 session, roughly 3 month modality addressing seasonal specific cognition and concerns. And the response rates are on par with light therapy. So the idea is doing that approach, right? Meds if you
Mhm.
need them, light therapy, and CBT. Especially once you've gone through 2 seasons and you know this is a vulnerability for a person, it's important to build in the patient education and protective factors.
Behavioral activation is one of the modules that is so important for some individuals with depression that has the atypical symptoms. I think the light therapy treatment plan is really behavioral activation. It's creating a habit that allows you to be activated and engaged with a structure, with a schedule.
Completely. And I mean, CBT, part of it's cognitive therapy, some of it's behavioral therapy. And that's where the behavioral activation lives for sure. Complementing those elements, the light therapy, psychopharm. There are also lifestyle, regular exercise, healthy diet, increased natural light exposure, and sleep hygiene optimization are important for seasonal affective disorder. We're talking about some like dietary approaches. We want to think about some supplements in this case. Vitamin D deficiency. It's actually not been well researched for seasonal affective disorder, but it has been pretty well researched for depression. Vitamin D deficiency can correlate with more depression. There was this one study, it was a meta analysis limited to women over 70, older with seasonal affective disorder. It was very like niche. But I think that, it's definitely something that we can generalize and kind of put in like part of our like tools in our arsenal. Clinical pros like take a level, see where they're at. But if you need to just start prophylactically, usually about 1,000 to 2,000 is a good place to
Mhm.
start.
Yeah, vitamin D supplementation is pretty common in the Alaska population. And I do say, like, we can check for sure, but let's just
Yeah,
start with the basic
let's just do it.
prophylactic 1,000. And then, really see if it's really severe, we really need to get higher doses. And again, look at your light exposure.
Yep. Another one is omega-3 fatty acids. Again, it's not considered like a primary treatment for seasonal affective disorder, but it does seem to play a supportive role in mood regulation. Fatty acids can influence the serotonin and dopamine pathways, which is why we kind of think about it. We talk about, the Mediterranean diet being very full of omega-3. It is really thought to be like neuroprotective and supportive with anti-inflammatory.
Omega-3 and vitamin D, if you go down the rabbit hole of research, which sometimes you and I do, not only does it have the research to help with mood, but it also helps with our heart health, heart disease. So it is something that is very healthy to have in your system. And I think that when people are taking these supplementations, kind of digging into how are you eating as well, because we can get some of these in our diet. And it's not only going to help with heart and even like bone for vitamin D. So, yeah.
Yeah, absolutely. Another intervention which can play into the lifestyle caveat, which I'm a huge fan of, is sauna treatments. Again, this is something where it's not like there's not a whole lot of body of sauna interventions with seasonal affective disorder, but there is a lot of understanding that sauna does correlate with a lot of like helpful supportive elements that could be really useful during this time of year. One being that plays a role with endorphins and relaxation. Just generally heat exposure can really promote muscle relaxation, which can improve the mood and reduce stress. The autonomic system effects, nervous system effects, really like let us kind of lean into the parasympathetic mode so that we get into like the rest or digest
Mm.
vibe. And it's much more calming. You can sleep better when we've had a good sweat. Maybe it's hard to exercise sometimes, and like a sauna can kind of at least bring you to that level of sweat that maybe you're not able to do with exercise alone. And so
Yeah.
you get some circadian improvement. Yeah.
When I think of sauna and massage, there's implications on how it really is grounding and that physical changes in your body. And it really is helpful for that parasympathetic nervous system to like get back on track because a lot of individuals, including me, we're overwhelmed or we're doing a lot and we have to take moments in our day to bring it down. And sauna treatments do that as well as massage. But it's just one component to help with your body to kind of reset. And also, I think there's been research on sauna and muscle recovery.
With whole body hyperthermia, there are some studies that show that there's some possible antidepressant like effects. All right. So these last couple slides tie into the lifestyle interventions because you're kind of trying to think about what is going to work for the patient. Not everyone is going to have the means to go get a ski lift pass and go skiing every weekend. People might just benefit enough from like getting out of the house.
Mhm.
I always say that this is a good time to try to like lean into your public third spaces. If you're part of a gym like a YMCA, oftentimes they have like indoor tracks. If that works for the person, that's great. If not, walking through a mall, just doing the mall walking thing.
Mm.
Home Depots are huge spaces that they can walk around for free. Museums, public libraries. Some places like Chicago has this amazing indoor botanical garden. I used to walk around there when it was like 15
Mhm.
degrees outside and be surrounded by like tropical flora. That was really amazing. But sometimes maybe they can't exercise outside, but maybe they can sit by a window and they can try to like maximize some kind of nourishment of outdoor daylight. Maybe they can try a new cold weather hobby if they're up for it. But sometimes I say just go for a scenic drive just to get out of your house. So there's a lot of things that you can do. But this is where sometimes leaning into a little motivational interview to figure out
Mhm.
what works for the patient. I also say try to lean into the indoor warm fuzzies when you can. So sometimes like starting like more of a new hobby could be like a little scrapbooking or some kind of sewing, or maybe you're doing a little bit of indoor woodworking, puzzles, like cleaning out like that drawer you've
Mhm.
always been meaning to. Now's your rainy day to
Mhm.
do it. Hot drinks can be very soothing, like leaning into like herbal varieties, getting some nice cozy socks, lighting some candles, get some new lights. Just finding different ways to kind of like nourish yourselves and lean into
Yeah.
like the quieter months.
And just finding new hobbies. There's all these hobbies that really help depression and help our cognitive capacity. So if you pick a new hobby, know that it's not just because stuck indoors and it might help my mood, but it actually has great benefits of your cognitive powers.
So this is an example of my winter seasonal treatment approach. I've got several patients and they go through these cyclic patterns. Usually as the summer starts to wrap up in September, we're starting to think about like, how did last year go with the season? Let's start to think about what our plan of attack is going to be. And then if they're on a medication like an SSRI, SNRI, or bupropion, come October is when I'm going to say, let's do that preventive dose increase because we know it can take weeks to get to the optimal dose range. If it's bupropion, I'm going to go from like, if they're on 150, I'm going to go to 300. If they're not on it at all, but we just do this for the season, usually like start at 150. And usually a couple weeks they're acclimated to that. And come mid-November, that's when I want us to achieve our steady state level of any kind of psychotropic intervention. This is when we're going to start to bring in the adjunctive treatments, light therapy, vitamin D supplementation, kind of go in with like as much arsenal so the person feels ready with all of their tools and equipment. We're going to check in with each other throughout December and February, see how things are going, tweak as needed, sometimes increasing like the session frequency. And a lot of times here it's like, okay, we're going to meet in 2 more weeks and be that much closer to daylight change. So it's a lot of, we're in this together. We're going to get through. And then come March and April, we're like, guess what? The days are, there's green stuff coming out of the ground. Where's the mood at? And if the mood is getting better at that point, that's when we start to think about decreasing the dose so that by May, usually they're back to the summertime dose. May, June, we're doing the beach. We're in the summer ball as well for a time. And again in September.
I love this treatment approach, that coaching and being there, like running beside them. I like the deprescribing. I don't think a lot of people talk about that enough. It can be uncomfortable because you're worried, oh no, maybe you need to be on this forever. But not really. If it's really looking at that seasonal pattern, we're going to taper and check in and then go back on if we need to. I think that's a lot of fear of a lot of patients is, am I going to be worse or alone? This really breaks it down for a clinician.
I love to share that because it's one of my favorite diagnoses. It works well with a person to take a collaborative approach and recognize external factors. It's a vulnerable time and we really work collaboratively on getting through it together.
Yeah.
And yeah, so that's a wrap for me. So I hope it's been helpful.
All right, folks, thanks for joining us today for this mini mindset episode. We hope you can take one insight from today and carry it forward into your clinical work, your learning, your life. Small mindset shifts can certainly lead to meaningful change. So until next time, take care of your patients and take care of yourself.